The Dumfries Hub is a multi-agency pathfinder, representing a new approach to ensuring people get the right support at the right time from the right services. The project co-locates staff with a wide range of expertise, all working with adults registered at the Greyfriars and Charlotte medical practices. The Hub introduces a new role, the third sector single point of contact.
I thought it was a really good idea. I mean, I think that we all understand that there's very limited resources, and we have to do something different in order to provide care to people, particularly older people, because the demographics are such that the older population is going to be absolutely huge, and we need to find ways of providing appropriate support to them.
It certainly makes life a lot easier, whereas before you'd pick up the phone and try and get a referral, and it would take maybe a day or two, or the person would be off, or someone else would phone you back. Whereas in here, we have daily meetings, and also if you need to speak to someone, then you can just go and see them, as opposed to sitting on the end of the phone.
For the whole health and social care hub, actually being the opportunity to be co-located together in a building was something that's never been done in Dumfries. So to do that was really, really good. But also at the same time, there was this period of, we didn't know what it was going to look like. We didn't know who the people were that we were going to be coming to work with. And there was all that sort of, we kind of know about them, but we don't really know about them. So coming into the building gave us the opportunity to actually see people face to face and do that.
It's really given us an opportunity to understand each other's roles and the pressures that are placed upon us. And also, really, I think the valuable thing is that we now work together more seamlessly to provide a holistic approach to services, etc. So that's been really beneficial.
It's very much patient-centred, and the outcome is for the patient, not just what we think might be good for the patient, but then we can actually take it to the various departments to make sure the outcome is for the patient.
We have a meeting every morning where we bring sort of people in and have, not actually literally, but we bring people in terms of discussions, and it offers the opportunity to see who's best placed to go out and do the visit, and it's not only avoiding duplication, but it's ensuring that people see the right person at the right time.
My role is mainly more overseeing and sort of working on doing the Plan, Do, Study, Act, the sort of test the change methodology. And again, if it hadn't been for the Putting You First in the programme and bringing all the sort of teams together, beforehand we had loads of workshops before we actually got here, so we had the opportunity to sort of get to know some people. So when you were coming to the building, then they were more like kind faces, and therefore it was easier to go and approach people to say, what do you think about this? Would this be a good idea? Could we do that as well? So that was really, really good.
As far as I'm aware, the majority of patients seem very happy with it. Things are getting done a lot quicker, they are getting done a lot quicker. There's a lot less red tape to get through, so it's certainly beneficial for the patient.